Good afternoon. Welcome to Ask the Expert. I am Michelle Marques, and in studio with me is Dr. J. Hi, how's it
Hello,
going?
good afternoon.
I like this blue color. It's
Oh,
very
thank
nice.
you.
Do you have lots of different what are they called?
Scrubs.
Scrubs.
Yes,
right.
this is my favorite. I like blue and I like black sometimes.
It's very flattering.
It is. Oh, thank you.
when my husband, he worked in dental for quite a few years,
Oh, okay.
and he would switch between sort of a gray scrubs and blue scrubs,
Oh, I see.
depending on
Nice.
what was available from the laundry.
Yeah.
But that's a very nice color.
Thank
So
you.
today we want to talk about a variety of different topics. Of
Right.
course, you deal with implant surgery, with wisdom teeth.
Right.
So these are more intense kinds of situations. It's not just your regular trip to the dentist.
Right, right.
But we do want to talk about sort of the health of the mouth and different things that can impact it.
Right.
Let's talk a little bit about tooth sensitivity. Why does that happen, and how do you treat it?
Right, right. So it's good to understand the anatomy of the tooth structure. The tooth is made up of three layers, if you will. I mean, the outer layer is the enamel, and the enamel has no nerves. That's why some people have cavities, and they look at their teeth and they see in the mirror they have cavities, but they have no pain. Because the enamel is about 3 millimeter in thickness, so as long as the cavity in the enamel, people don't have pain.
Okay.
Once it goes deeper to the dentin, which is actually live tissues, it has nerve ending. This is where people have pain or sensitivity, and the deeper it gets to the enamel down to the pulp of the tooth, where they have the blood vessels and the nerves, here where the pain get very, very intense. Sensitivity has a lot of lots of reasons. There's many factors for them to happen, but in general, sensitivity can be caused by cavities. It can be caused by gum diseases because the root of the tooth has nerve ending as well. So when the gum shrinks, it exposes the root surface.
Got it.
And it could be as a result of grinding. Grinding now becomes so with people now under stresses, the pandemic, and then the economy. People grind their teeth, and then one of the finding we see with grinders are sensitivities. There's so many factors. So once anybody has sensitivity, they have to really know or discuss with their dentist what's going on, so we kind of pinpoint the problem and treat it.
Right. So if it is grinding, is a night guard a good idea?
Right. Now, that's a very good question, and I always go with into a very interesting discussion with my patients. Night guard does not actually fix the problem, it actually controls the problem. Grinding has a lot of deeper causative factors.
Okay.
It's a result of stress.
Right.
I have seen, and you'll be Michelle, you'll be shocked to hear that during the pandemic, in the middle of the pandemic, I have seen people they're coming to my office, cracking their gold crowns and ceramic crowns. They crack them open, and I have never seen that before, and it's only from grinding. So I did some research, and I found that when somebody is grinding his teeth, he is creating over 1,200 pounds per square foot of forces on their teeth that can make some of these teeth split.
Oh my goodness.
Okay, so night guard is part of the solution, but I tell people, hey, let's dig deep into it, and I like to talk, and I'm a bubbly guy, I like to talk to people. And we try to, and I tell them, hey, I'm not a psychologist, I'm a dentist, I'm a dental surgeon, but if you're my brother, this is what I would suggest. Look deeper into it. Think about yoga, think about if you are a person of faith, think about prayer. Okay, connect with God. If you are into sport, do more sport. Because once you disperse this negative energy out of your body, the grinding is going to get decreased. So what happens is, when you are having a lot of stress about an issue, you go to bed. Your subconscious level, your subconscious brain is going to try to, it's like a little dog want to show you how much he loves you. So the subconscious brain, if you will, is going to keep working to find solutions. The problem is this: the masseter muscle, which is the strongest muscle in human body, which is literally in your cheeks,
Mm-hmm.
the strongest muscle in your body is gonna contract in response to show some sympathy to the brain that's
Oh,
that's
okay.
thinking of having solution.
Right.
So when the masseter muscle contracts so hard, who's gonna get the beating? Your enamel and your
Right.
teeth, and then you end up with enamel wear, sensitivity, and all of these problems. So we always tell people head and neck massages can help. Again, prayer, meditation, cognitive therapy, talking to a life coach or somebody who can help.
Mm-hmm.
That will be an important that have an important role, of course, beside the night guard at night to help.
Yeah, that's fascinating because, of course, we know that the body is an entire system, that things are connected.
All connected, yes,
Yeah, yeah.
absolutely.
And, the health of your mouth is very important for your heart health, for everything else.
Right.
But that does make sense that your brain, if you're going through a bunch of stress, your brain at night is trying to figure it out, maybe
All connected.
reworking that stressful situation over and over again, and your brain doesn't know the difference, your body doesn't know the difference if you're awake or not, and it just starts doing those stressful activities again and clenching
Absolutely.
down. Wow, I didn't
Absolutely.
think about that.
Stress is a killer. I mean, we all know the heart diseases, the nervous breakdown situations, and diabetes, and a lot of health issues is caused by stress. So if we control that problem,
Mm-hmm.
many issues could have been resolved.
All right, very important.
Right.
What about sensitivity in teeth to heat or cold?
Right. This is also related to cavities and gum problems as
Okay.
well. Sometimes when people get new crowns or new fillings, right after the filling or the crowns, a few days later, sensitivity is a normal consequence of such treatment. It's normal. But in general, it has to do with the nature of the gum and the nature of the tooth. Now, some people are just sensitive people.
Mhm.
Just by nature, they are sensitive. In this case, most of the doctors will recommend like a desensitizing agent that comes with some toothpaste, like
Mhm.
some Sensodynes and
Okay,
Colgate,
gotcha.
some other companies. They
Mhm.
have some special toothpaste for sensitivities.
Okay,
Right.
all right. And are those effective, do you think?
I believe so. I mean, I didn't try them,
Okay, sure.
but when I tell my patients, they come back and they tell me yes,
Okay.
they can see some progress.
All right, excellent.
Right.
So those special toothpastes that say that they help with sensitivities can
Right.
be another treatment. And then, of course, just making sure that you have a healthy mouth. So
Right.
going regularly to your dentist to make
Correct.
sure they catch the cavities and any advances in gum disease, that sort of thing, is important. to know.
Absolutely,
Okay, very good.
absolutely.
Let's talk a little bit about veneers and crowns, and what is the difference between them?
Okay, I always get in trouble when I talk about this because dentists don't like me to talk about this subject. But we have to say what we believe in. I mean, there are veneers, which is a very thin layer of ceramic that is glued into the outer layer of the tooth, and there are crowns, which basically covers the whole. They cover the whole tooth.
Mhm.
Okay. Uh, Veneers are very highly aesthetic. They look beautiful. The main problem with veneers, from my experience, and this is my personal opinion, okay, they don't last that long. So when you invest a few $1,000s in your mouth, you want to make sure what you invested on would last you for at least 10, 20, 30 years maybe, okay? But the problem with veneers, they don't last that long. They can last you maybe up to 5 years. If you are lucky, maybe 7 years. And not every patient can be a good candidate for veneers. People who are grinders, we're talking about grinding,
Yeah.
they will pop them out right away, or maybe in a few days or in a few years, few months. People with sensitivity, they will suffer after getting veneers. Okay, because veneers, they kind of like, some of them get into the dentin, which is sensitive, which has
Okay.
nerve ending,
Right.
and that cause a problem. They don't have a full coverage of the tooth, so there is some little exposure of these
Right. Okay.
quote unquote nerve ending. So personally, I tell my patient in advance, hey, if you want veneers, fine, but this is the problem. Are you willing to take risks? the other problems are because they don't have a full coverage of the tooth, they are weak. So if you eat apple, high chance to crack them. And that's why you see that the instructions after veneers are do not eat, don't bite with these.
Right.
Well, what's the point if I cannot bite with my teeth? Why I'm investing all this much time and money for that? So personally, I highly recommend people, if they want to have a nice aesthetic, is to go with crowns. I mean, they crowns can live 3 times more than the veneers. They are strong, they're highly aesthetic, and they're good return of investment over a long term. Plus, the crowns have many options. You can do, if you want to be fancy, if you want to be aggressive, you can go with gold crowns on the back teeth. Gold crowns are, I would say they're amazing. I mean, they last for quote unquote forever. They last up to 45 to 50 years. The crown can last 50 years.
Wow.
Okay, the gold crowns, and then you can go with zirconia. You can go with ceramic. There is so many options, and you can pick the option that actually match your criteria.
Yeah.
But with veneers, you are very, very limited in the options that you have.
Okay, that's good to know.
Right.
That's so funny that you mentioned that because my sister, her fiance has veneers, and he says he won't eat apples. Like he can't.
What's the point?
No.
That's right.
That's so crazy. All right, I am talking with Dr. J. You can find him at cadentalsurgeons.com. You can also call his office at 707-539-6777. That's 707-539-6777 at Valley Dental Surgery and Implant Center, which is located right here in Santa Rosa. We're going to take a quick break and come back and talk about other aspects.
With Dr. Hani Jamah on KSRO.
And welcome back. I am Michelle Marques. In studio with me is Dr. J. You can find him and book an appointment or just ask some questions by heading to his website at cadentalsurgeons.com. That's cadentalsurgeons.com. Give a call to his office to book an appointment at 707-539-6777, 707-539-6777, and they're located on Sonoma Highway in Santa Rosa. It's Valley Dental Surgery and Implant Center. We're talking about the health of the mouth, and one of the things, I mean, I remember, I don't have a tongue piercing, but I remember being like 12 and being so excited about getting my ears pierced, and now I never wear earrings. So they're pretty much like closed up. But what is, this is on the outside of the body, right? The ears, there's certain complications and things that can happen when you pierce your ears. But when you pierce your tongue, what kinds of complications can happen?
Right. So I personally believe people have the freedom to do whatever they want with their bodies. It's none of my business. But when it comes to health, I have to step in and I have to be a little bit loud and clear. Okay, basically.
Sure.
So from my experience, when I see people coming to me with tongue piercing and lip piercing, this is the problem. This is a very mobile area. You have muscles, you have tissues, you have food getting there. And think about it. Think about a closed place, no air, okay, that much, okay. There is humidity and there is food. This equals bacteria.
Yeah.
Bacteria with humidity and food equal infection on the long term. Beside this, any mobile object that's metal or even plastic, any hard object, you have a very smooth, gentle tongue, and the tissues under the tongue are very delicate. You can actually see the redness under the tongue because it's a highly vascular. There's a lot of blood there, blood vessels and all of these network of tissues. When you put a piercing, metal or elastic or plastic or whatever, you're having this a continuous rubbing around these tissues. And when there's 2 areas here. You have rubbing against the tooth, and then on a long term, you're going to have the tissue enamel is going to disintegrate. You're going to have the gum is going to shrink. And then you end up with sensitivity problems, cavities. And then on the other hand, which is more dangerous, any soft tissue in the body, when it's subjected to a consistent irritation, we have a possibility of having hyperplastic tissues. Tissues start changing in their shape,
Oh my.
and we end up with tissue growth that could be malignant. So why I would put myself in that condition, in that situation where I expose myself and expose my teeth to infection, possibility of malignancy and tumors, for what? I would say, I tell the younger generation people, please stay away from that. I mean, life is not worth it to go that direction with these kind of risks.
Yeah. Yeah. Maybe just get more ear piercing.
Thank
if you
you.
need to.
Yeah, absolutely. Absolutely.
Yeah, but it does make sense that it could cause some serious issues
Right.
in the mouth, all the ones that you've just explained. Okay, very good.
Right.
Let's talk a little bit about a procedure that I'm sure is popular with a lot of people about teeth whitening. What are your thoughts on teeth whitening?
Right. Again, some dentist is going to hate me for saying that. There are tons of teeth whitening outside. There are very commercial teeth whitening that's over the counter.
Mm-hmm.
I highly discourage people to go there,
Oh,
and
okay.
very simple reason. When you go over the counter and buy these products without your dentist's recommendation, these companies, to give you the wow factor, what they do, they put very high concentration of bleaching agents. Okay, and you go now. Your mouth was not. Your teeth is not clean. Maybe you had dinner. Maybe you had something sticky in your teeth. So in order to give you the wow factor, you put these strips on your teeth, and in no time they're white. So what happens? This burning, bleaching sensation, burning or bleaching effect,
Mm-hmm.
over time will lead to deteriorate the enamel surface.
Okay.
And enamel you cannot repair enamel naturally. You have to do fillings and crowns, and you end up with sensitivity issues. So it's a very expensive damage. So I highly recommend people to stay away from the over-the-counter products. Again, that's my opinion. Now, when it comes to the professional way, there are two ways to go. There is a way, they call it a laser teeth whitening, which is, I think it's a gimmick.
Oh, okay.
Yeah, because it's basically the office. Some dental offices will do a very high concentration of bleaching gel, and then they put something called, like, they call them laser, but actually they're just a UV light.
Okay, UV light.
They create heat, and that with high heat and high concentration, the bleaching will take place. But this is the problem. They burn the gum, and they cause severe sensitivity afterwards. Some patients actually, they end up with getting root canals because they had nerve damage that became permanent in their teeth
Because of
because of this. Well, because of the quote unquote laser teeth whitening or UV light teeth whitening, which is it's like 1 hour intense session. Completely, it's not recommended. Okay, I think many offices stopped doing it, but still some offices do. To my knowledge, they think it's cool, but I think it's not a good idea. The best way, which is slowly but surely, okay, it's basically patient come in, we take an impression, like measurements, and we give them low concentration, okay, but long-term effects. So they wear it every night, maybe every day, for 1 hour. They put the 1 drop of bleaching agent or whitening agent on their tray. It's like a clear tray, like an Invisalign tray, and they wear it for 1 hour every night, okay, for about a week. Slowly but surely. It's not strong enough to burn the nerve or burn the gum, but it's strong enough to make changes over a course of a week or two.
Okay.
These are perfect. We get great results with minimal side effects. So it's called the in-house teeth white. Well, it's like it's a take-home kit. The doctor, the dentist make it. It's a bunch of trays and some gels. You take it home and you get the great result afterward.
Now, when you talk about great result, what do you mean? Like, how significant is it a difference? Is it something that you would notice yourself?
Yes. So there's two factors. Well, there's two kind of stain. We have to understand the stain to understand teeth whitening. There is intrinsic stain, which is built in. It's people who had water from the wells, or they
okay.
were in the country. There's lots of fluoride content, so their teeth are grayish. Okay. Uh, Teeth whitening may do a little improvement, but not that much. Okay. Then we have extrinsic stain, which is stained from wine, coffee, eating strawberry, chocolates over time. Teeth whitening is very effective to change these if it's done after the cleaning procedure.
Okay.
The patient get their teeth clean, then they will see a very good result. Actually, you can get up to 3 to 4 shades whiter, actually.
Wow,
Oh, yes.
okay.
Yeah. Again, it depends on the person, how dense their enamel. There's so many factors. How high is the concentration of the teeth whitening agents?
What about smokers when stained?
Same thing,
Is
yes.
the
It's
same
very
idea?
effective. But this is the problem. People do their teeth whitening, they go smoke,
Right.
or they have wine. So smoking, wine has a very high concentration of coloring agents,
Right.
natural coloring agent of the grape that also cause a problem. So people who go for teeth whitening, I highly recommend them to abstain from alcohol, any food or water or liquid that has coloring agents for at least 3 days, so it
Okay.
can settle in their teeth.
But then you can go back to your Zinfandel like a week later. Or so?
Sure, whatever
Okay.
they want to do. Right.
Trust me, I went to a Zinfandel festival in San Francisco, and I got there towards the end of it. Everybody had purple teeth. Everybody had purple teeth.
Right, right.
So it definitely can have an impact over the long term. Well,
Oh, yes.
these are all great tips, and
Thank you.
we appreciate you coming in and
Thank
talking
you.
about mouth health and things that can happen. If you would like to learn more or book an appointment with Dr. J and his team, all you have to do is head to cadentalsurgeons.com or call his office at 707-539-6777. 707-539-6777 at Valley Dental Surgery and Implant Center. We'll see you in a couple weeks.
Thank you. We'll see you then.
This is KSRO.